Hi, and welcome to Pennsylvania Newsmakers, and thanks for watching. Well, as we end calendar year 2006 and begin to move into 2007, universal health care is on everybody's mind. We're going to talk about that subject with one of Pennsylvania's preeminent experts and take on a couple of other subjects when we return.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host.
Hi, welcome back to the program. Well, as everybody knows, or everybody should know, Governor Rendell will soon be making his second-term agenda. He'll be putting it out before the citizens of the Commonwealth of Pennsylvania, and he's made no bones about it. He wants to extend health care coverage to more of the 1.2 or 3 million Pennsylvanians without any coverage. Could that mean some kind of universal health care? Is that good? Is it bad? Joining me now, as often is the case, is the president of the Pennsylvania Medical Society, Dr. Mark Piasio, to chat about universal health care and some other subjects. Welcome, Doctor.
Always a pleasure to be here.
Well, look, we've talked about a lot of subjects in the last couple of years. One of the subjects you and I haven't chatted much about is universal health care. We now have at least a major experiment going on in one state, Massachusetts, where everybody is going to be required to have health care coverage, and where, you know, they're going to fund it in a variety of ways. Let's talk a little bit, first of all, about, is this a good idea or a bad idea?
Well, it's an excellent idea, and we've all along felt that whether you do it through insurance, government, or whatever, however you want to finance the health care, everyone in America, the richest country in the world, should have the ability, should they become ill, that they're not impoverished, so that they can get the care that they deserve and need. And we've supported that concept from the very beginning. The question is, as always, is how do you finance it and how do you deliver it? That's right. That's where it gets a little bit tricky. And there are certainly different approaches to how we go about doing that. One, obviously, is the pure socialized system where the government pays and we all work for the government. And then there are other, more sort of combinations of government and private sector in delivering the health care. And then you see, of course, what's going on in Massachusetts and maybe Maryland, which are different approaches to using the private sector to continue to deliver the care. But
I think as we think about this subject, we already have everybody gets some kind of health care right now. As you know, people will show up in doctors' offices or show up in hospitals and get care. So in effect, all of us in one way or another are paying for the health care that Americans get now, whether it's high-end, the best health care in the world, or scraping along, we're all paying for it. So is your point that because the system's paying for it anyway, we ought to make it more fair and equitable and give everybody at least a floor below which they don't sink, in other words, for their health care?
Well, those are where some of the debates come in. Do you want to have products that are essentially mandates with all kinds of full coverage, or do you want to allow the consumer to purchase products that are more designed for them? And those are two reasonable debates as to how you want to go about doing this. In Massachusetts, they're actually doing a very interesting approach where they're trying to create a market where anyone in the state who are now going to be required to carry insurance or pay penalties, but there's going to be a marketplace available where they can choose a host of products that are approved and supposedly financially viable. Maryland, and maybe the governor, I don't know his plan, I haven't seen the details of it, are looking, I believe, at more at having one sort of plan with multiple players providing that type of coverage that covers essentially as many things as they can get into that, as opposed to having them more individually aligned. Now, those larger plans are obviously more expensive, making it more difficult for the private person to purchase something.
Isn't one of the problems when we don't have health care coverage, what happens is that there's very little preventative care and sort of maintenance of your health, so that when you get a problem, it's far worse and more expensive than if you've been under treatment for a long period of time.
There's certainly a lot of truth to that. We took some really close looks in looking at even across certain demographics as to who would be getting preventive care. Let's say 50-year-old men. Are they getting their colonoscopies? And what was interesting was that it had nothing to do with their income. It had everything to do with whether or not they had insurance. So a 50-year-old man is very wealthy, is not getting the colonoscopy that he needs, but those who are insured are. So there's obviously something in our psyches culturally that when insurance or some other payment system is covering preventive care, we seem to do a better job pursuing that.
All right, we're going to take a quick break. When we come back, I'm chatting with Dr. Mark Piasio. He's the president of the Pennsylvania Medical Society. We're going to continue talking about universal health care. There's a couple of other subjects that I want to get to before the end of the next segment. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers. I'm chatting with Dr. Mark Piasio. He's the current president of the Pennsylvania Medical Society. We're talking about universal health care. I want to get on to that subject again and another subject or two, and then we're going to talk about health savings accounts. You might consider this to be our health care update. All right, doctor, let's talk. I have another question about this. Universal health care. This is a huge debate that's going to take place. Do you think this is sort of inevitable that we end up with universal health care? I mean, is this the way of the world now?
Well, I'm not sure it's the way of the world, but I certainly think that in the richest country in the world, we should be having not so much the debate, but the discussion. Mm-hmm. And my hope is that we have a collegial discussion and then move forward and actually do something. It's, you know, to think that we've got 40 million Americans who, since we finance health care through insurance, don't have insurance, that's to our organization, is completely unacceptable.
Now, even though if we do go to some kind of universal health care, there's going to be stricter regulations on hospitals, the medical profession, on consumer use. I mean, the government's not going to pay for this.
Right. I think we all understand between business and government, you know, we're getting to about the limits of how much money is available for this product. So we look at this as a wonderful challenge to try and look at what we're delivering, what is high value and what is of low value.
Right.
And we don't have those metrics yet, and we're trying to work on them to decide where we really want to spend the money, which is not unlimited. Mm-hmm. We come up with new technologies, and some of them are wonderful, but they are costly, and we've got to make some hard decisions. So we seem to be moving more towards a consumer-directed health care with the health savings accounts and these other ways that consumers are going to be empowered to see the quality of the facilities, quality of physicians, get an idea of the value of the products, and hopefully empower them to make wise purchasing decisions different than what we've done in the past. So those are really the two forces that are kind of coming at heads here. Do we want to have one solution fits all or multiple solutions but make everybody play?
But I don't know. I mean, in my judgment, I think it's coming. It's just a question of, as I think you appropriately pointed out, who pays for it and how it's delivered. They're the two fundamental questions.
Those are what we're working on now.
Okay.
Financing and delivery.
All right.
You got it exactly right.
There are two other subjects, if we can get to them. I want to talk about Pennsylvania's lack of a helmet safety law. You know, this is always debatable.
Right.
You know, the state did away with it. The state legislature did away with it a couple of years ago. The society has some concerns about that. Obviously, fairly obvious, but go ahead and state.
Well, we have always had concerns with it. The good scientific data has shown from day one that states without helmet laws have higher death rates and much higher costs for closed head injuries than states that do have helmet laws. We're looking at, just since the law went into play, where they rescinded the requirement to wear a helmet, where we've gone from $64,000 to $95,000 costs for head injuries, and helmets seem to reduce significant brain injury, 40% compared to non-helmeted riders. And I could certainly say that I take this very seriously because I am a motorcyclist, and I've been riding since college, and I've never gotten on one without a helmet. That's even in the garage.
And I guess when they would have these rallies in the prospect in trying to get the Pennsylvania law repealed, which they did a few years ago, the supporters of the people who don't want to wear the helmets, and they said it's an individual right. It may be an individual right, but we all pay for that right.
We collectively pay for it. That's correct.
Yeah, I mean, it's not like people are immune. Who pays for the medical services and the coverage and obviously it's all of us as a whole. It's society as a whole.
If you start to extrapolate the additional costs from riding without a helmet, across the state, it comes into hundreds of millions of dollars, and that would provide insurance for an awful lot of kids. And
all right, I want to go to one other subject before we let you out of here. And as always, thanks for coming. One of the concerns I think that the medical society has, and that a lot of us have, are creating more educational opportunities for different folks of different backgrounds in our country. I know that's of great concern, specifically, what is being done to address so that we get more diversity and more educational opportunity for a wide array of people, whether minorities and women and other folks, to go into the healthcare professions, not just doctors?
Well, first and foremost is recognizing the issue. When we're looking at our changing demographic across the state, what do people look like? What are they going to look like in 10, 20 years? And we obviously want our workforce to reflect the population. We've done a very good job at getting women into the professions, but not such a good job with the Hispanic and African American community, and looking at our ability to get them or to attract that particular group into our fold. And we're seeing the attorneys are having the same problems. We've been working very closely with the Pennsylvania Bar on this issue and trying to find out how do we attract these, a diverse professional group to Pennsylvania. But what we're finding is that we're not creating them, and that at some point in times we think in the elementary and middle schools we're not doing a good job in terms of encouraging students to pursue these professions for a host of reasons, economic, family issues that are making it difficult for some of our minorities to get into a professional school.
Yeah, and it's about the pipeline. I mean,
exactly.
It's about keeping folks in school longer, assisting them in science and mathematics, as you know, as core elements in science and medical education.
Or anything for that matter. We're looking at it to do well in these difficult professional schools, whether it's architecture, engineering, medicine, or law. We need very well prepared secondary students, and we also need students that want to do it. So we're trying to get into those schools to make sure that, one, they're getting the education they need, but number two, they're getting the support that they need to make this a reasonable choice for them.
All right, as always, thanks for coming on. We'll see you in a month or so for another update. Health savings accounts, they're available. We're going to chat about the details of it so that you all are better informed about it. We'll be back with that subject after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers. Well, this is our monthly health care update. We're going to switch from universal health care and lack of a helmet law in Pennsylvania to a subject I think that all of us ought to know more about, health savings accounts. Joining me is Eric Beittel, who's a member of the Pennsylvania Association of Health Underwriters. He's going to talk about the benefits of this program. Let's talk a little bit about health savings accounts, Eric, sort of generically. What are they?
Health savings accounts are, if you take a particular type of health insurance called high deductible health insurance, and usually that deductible has at least a $1,000 deductible for an individual or $2,000 for a family, you can then set up a health savings account at a bank or any financial institution, and you can put money into that account pre-tax and then use that money to pay for your medical bills. The idea is to put a little bit of consumerism into the first few dollars or first couple $1,000s of health insurance.
And let me get this straight. So the whole purpose of this is that, let me think about this. You get a tax break because it's before tax dollars, right?
Yes.
So in effect, if you put, let's just assume for this argument we got $2,000. You'll take $2,000. You would get this taken out of your payroll, maybe?
Your employer could put the money in.
Could put it in.
You could payroll deduct it in. You could write a check and just put it in the account.
So then that $2,000 you would be able to use for medical expenses throughout the course of a calendar year.
Correct.
And what are the kinds of medical expenses that are covered by these accounts?
Almost anything medical related. I mean, the IRS dictates what's a qualified health expense, but anything from dental to vision to prescriptions to doctor visits to knee surgery.
Yeah, we can talk about that. All right, so the advantage, I mean, is the advantage that you get to decide how you spend it? spending money? I mean, wouldn't you have that within most health plans anyway?
Well, a couple different examples, maybe. I'll give you a great example, which sold me on health savings accounts right out of the gate. My son, who now he's 5, but when he was 3, he had hurt his chin. And my wife took him to the hospital, took him to the emergency room. And it was very minor. It didn't need any stitches. A physician's assistant basically put Durabond on it and cleaned it up and sent him on his way. When I got the bill from the hospital, there was a itemized list, and it had a specialist's fee, a suturing fee, and a couple different things. And I just said, some of these things don't add up. They didn't happen. So I called the hospital, and since I was responsible for paying the bill, because I have a health savings account plan, it was in my financial interest to look at it. Once I called the hospital and they reviewed it, they said, you know what, these things didn't happen. They cut the bill just about in half, and we were on our way. It puts a financial interest in my...
So in other words, you become a more involved consumer of health care. Is that it? You're going to go out and you're going to investigate more. You're going to look, instead of just going up and taking whatever services get provided, you're going to be a more introspective consumer. Is that a way to put it?
I think so. If in that scenario, if I had a traditional type of health insurance, I probably would have just been concerned that the health insurance company was paying for it, and not whether the bill was correct for the services provided.
Yeah. What about this question about whether or not families should do it versus individuals? I mean, does it make a big difference there?
I don't think it makes any difference.
You could be in any kind of family whatsoever. Are you allowed to put under this is a federal law we're talking about, right?
Yes.
Are you allowed to put back a certain amount of money for each person in your family, or is it limited to a set amount per family?
You can set aside each year whatever your deductible is, to some limits. My deductible is $2,400, so every year I can set aside $2,400. If I spend it, I spend it. If I don't, it just rolls over to the next year.
Oh, it does roll over, so you don't lose the amount of money that...
And that's very important, because it's a motivating factor to be an educated consumer.
You talked a moment ago about the fact that you could go to a bank or an insurance company. Where are most of the folks who have these accounts? How are they getting them today? How are they setting them up?
There's a lot of banks that are doing it, smaller banks that are more interested in dealing with maybe small businesses or individuals. Some of the bigger banks are rolling them out.
Right.
But there's a variety of institutions that are doing it.
All right, I'm chatting with Eric Beittel, who's a member of the Pennsylvania Association of Health Underwriters. We're talking about this important subject, health savings accounts. We'll continue our conversation after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program, Health Savings Accounts. They've been out about 2 years. Eric was telling me at the break about 4 million people have signed up for them.
I think that's about the number right now.
Is it the wave of the future? I mean, you've testified before Congress. Is this something you think that they're going to continue? Is there any debate about ending this program?
It's a politically sensitive and volatile subject, to say the least. I think that there's been so much demand already for them that the likelihood of them going away is pretty slim.
Now, but they do have some amendments. I mean, they may revise it. I mean, one of the things you might hear is that this is just another program that benefits the people at the top of the economic ladder, that this isn't a substitute. You know, in the last segment we were talking about universal health care, that it's not a substitute for universal health care, that it helps some people maybe who are wealthier, who can afford to put away a couple of $1,000s off the top of their income. Have you given that any consideration? I mean, is that how serious a concern is that?
When you look at health care and how it's handled tax-wise,
right.
You know, an employer pays for your health insurance and it's tax deductible to them. So what health savings accounts do is it gives the same tax status to money that you're paying out of your pocket for that health service as the health insurance gets. What's wrong with that?
Yeah.
Why should I get the same tax treatment for my insurance company paying for my prescription than me paying for my prescription?
Sure, I get your point. So if they're getting it, why shouldn't you get it?
Exactly.
Yeah.
Exactly. And health savings accounts bring more people into the system. Mm-hmm. It's a more flexible, cost-effective way for employers and individuals to get health insurance. And if more people are in the system, it's better for everybody.
One of the other concerns, and I think you addressed this in your testimony before the United States Senate dealt with this question of how much medical information the employer should have. How much medical information does the employer get if it's an employer plan? I guess all of the bills have to be submitted so they would get to see what it is that you've just gotten done, right?
Actually, that's the beauty of health savings accounts, is the employer's not involved at all with seeing those bills.
Really?
It's the employee who gets the bill, pays for the bill out of their health savings account. Mm-hmm. So really, you know, some other programs you did have to submit the bill to your employer or to a third-party administrator to get reimbursement. Health savings accounts you don't. So as far as employee privacy, it's much, much better.
So then,
but I
I
think what you're getting to is health savings accounts are different, and it takes a lot of educating employees to make them work. And the problem is I think what some people fear is that employees naturally go to their employer, because it's an employer plan, to get that education. And employers, you know, are looking for the tools to be able to provide that to their employees, to provide that education. Plus, they're a little nervous. I mean, I don't want to know all the health issues of my employees.
Well, I'll tell you, this sounds, I mean, 2 years old. Obviously, Congress is considering some adjustments to it. It's certainly something that's growing. We'll have to see what happens if we go to universal health care, whether they would continue them or not. You never know. But I want to thanks for coming in. Excellent update. We'll keep the folks at home apprised of whatever changes take place. And we'll see you next week for another edition of Pennsylvania Newsmakers. And if it's appropriate, stay well.